Good morning. I'm Carolina Victoria, oculoplastics based out of Miami, and I'll talk to you about complications of aesthetic procedures and how to avoid them. And we'll talk about the tear trough today. So what we see here is a normal tear trough, and you can see that it's got nice definition between the eyelid and the cheekbone. Now, some patients or some people do not like this appearance because it makes you look tired. However, notice the normal anatomical structures of this eyelid. This is an untouched patient who wanted to look more refreshed on her lower eyelid, specifically the tear trough area. Let's also compare this patient who actually underwent a lower eyelid blepharoplasty that had fat excised from her lower eyelids. And you can still see here that there's a little bit of a tear trough deformity, perhaps some hollowing of the lower eyelid tear trough area. And so the goal of fixing the tear trough area is not to overfill and not to get rid of the normal anatomy, but rather augment a natural look while still preserving the anatomy. So what we see on this patient on the left-hand side is an overfilled tear trough. The injector also used the wrong type of filler. They used hyalocross technology, which I do not recommend to be used in this area. And you can see that she looks swollen. What you can see on the right-hand side is a patient that underwent a conservative tear trough filler while still maintaining a natural look, not swollen. Now, a tidbit of advice when filling the tear trough, do not fill to 100%, but rather less is more. You can do it in small sessions until you're happy with the result. Another tip is that filler in this area lives for a very long time, which means that years down the road, what looked like filler that was sitting in the correct position can eventually show, like this patient on the left. And the good news is that you can dissolve this filler to achieve a more cosmetic result. Thanks for listening, and I hope you enjoyed it.